Hello everyone. I'm just waiting for our guest to join. Hi Hafsa. Hi Vidya. Hi Adi. Hi Ramya. Hi Rashmi Didi. So happy to see all of you all. Hi Vidya.
Hello.
Hi. Let's wait for Dr. Smriti to join.
Yeah.
Yeah.
Okay, somebody is asking what are we discussing today? We are
Hi
going to
Pooja.
discuss. Yeah.
Yeah. So today's topic is mainly on the skin and hair issues during the postpartum period. Okay, so let me just add Smriti. Yeah. Yeah, Vidya, you want to address it? Thank you, Rashmi Didi. Hi, Dr.
Hello.
Smriti.
Hello, namaste.
Hi.
Good evening.
Good evening.
My voice is clear?
Yes,
Yes, pretty
yes.
much.
Great.
Yeah. So there was a question, right? I mean, before we proceed with our session, maybe like we can answer that, right, Vidya?
Yeah. We can just let them know what we are going to
Yeah.
talk and
Yeah. Yeah, so mainly today's session is we are going to talk about the different skin conditions that a woman might face after having a baby. Okay, so that includes melasma, stretch marks, itching of skin, and we're also going to talk about postpartum hair fall, which is pretty much common in many women, after giving birth. Yeah, so I think that has answered the question. And hi, Dr. Smriti.
Hello.
Really happy to have you with us today. I would
Same
like
here.
to share a small introduction about you before we actually proceed with the session. Yeah. Okay. Just one second. Yeah. So, hello everyone. We have Dr. Smriti with us today, and Dr. Smriti is a dermatologist. She has done her MBBS and she specializes in, she has done her MD in skin BD. She is that kind of a student who is always a topper. So, she was first in the boards. She was a topper in class 12 and in MBBS, and then she also went on to be a gold medalist in MD. Uh, she has been practicing for more than 10 years right now, and she has worked in different fields. She has worked in plastic and cosmetic surgery field. She has also worked in hair transplant field. Currently, she is associated with Fortis Hospital in Mulund, Mumbai, as a consultant dermatologist. And throughout her career, she has treated and managed difficult cases of skin diseases, allergies, and drug reactions, and she has also handled all these cases with patients who had other underlying health conditions, diabetes or heart diseases or kidney diseases. And her patients also include the pediatric population and also pregnant women. And some more things, I just want to add about her. She hails from a family of science, okay, and that scientific temper is kind of ingrained in her. We can see that very clearly, in the way she talks, the way she writes. okay, her overall thought process. So like, if you approach her with any kind of skin issue, she is not the kind of person who's just going to scratch the surface. She is the one, like, she believes that skin is the mirror to your overall health, overall physical body health, as well as your mental health. And like, she believes that if you have to treat something that has occurred on your skin, you also need to treat the underlying cause. So that's the kind of passion or belief she has. And like, she believes in, like, looking at the overall aspect of it, like, your eating habits, your sleep, the kind of stress management that you're having, your overall lifestyle, how your overall lifestyle is. And she is a person like that. That's something that I really feel she practices what she preaches. So if you just go and have a look at her Instagram feed, you'll be like, all convinced with whatever I'm telling here, because, it is completely like, chock full of healthy recipes, healthy food, healthy, tasty food. That I recently saw that chocolate beetroot cake, and it was like, just amazing. Looking at that ingredients, I was like, yeah, I mean, it's the best thing that, anybody who really wants to eat healthy and at the same time, like, enjoy really, like, enjoy your food. I mean, that was the best thing. But then apart from that, she's having, like, loads of articles written on healthy skincare ingredients and yoga asanas. So she is like, I feel that she's a complete, like, role model for a healthy living. Like, it's like, from within you have to feel healthy for your skin to reflect that health. And yeah, she has been, like, a part of national and international conferences as well. She has published papers in PubMed index journals. She has co-authored many Indian books. She writes, and she's a prolific writer. She writes like, both in print and on social media. And the list is not ending here. She is also, she has done her BA in Bharatnatyam. That word, Dr. Vishaprad, right?
Vishamad.
Yeah, yeah. So she is a qualified Bharatanatyam dancer, and she has done all this, like, while being a mother to two kids. So that really calls for a round of applause, I feel. And we are, like, really happy and kind of like, it's we're grateful that you accepted our invite and joined us for this live session.
Thank you for a wonderful introduction, Niloofar, and thank you, Vidya, for inviting me to join here. It is true, actually, my journey of all these things actually started, being a mother and all those things. I was a person who would, like, never enter into the kitchen. And I would just not go. But then when I became a mom and I'm being a science student, I would be like, I want to give the best to my kid. And that is what every one of us, each one of us here, whether mothers or fathers, all of us, right? Parents, we want that to happen, just the health of our kids. So that is where my journey, personal journey started when my daughter was born 7 years back. And I started reading more about nutrition and all those things. And then eventually it moved on to, not only the kids, but myself, and then the family members and the parents and the patients and all those things. So yeah, so today's topic, as Niloofar has said very rightly, is what the new mothers, deal with regards to their skin as well as their hair when they just get delivered, especially in the first few months, in the first year of the life, when everything is haywire. You have just delivered. It's a new birth to the mother. You have not only given birth to a child, you have got your own new birth. Everything is so new. You are sleep deprived. You just don't have, you just don't know anything that was there before. And then you have all the kinds of changes that is happening with your skin and hair. So this is what we are here to talk about. Over to Nilufar and Vidya.
Yeah, thank you. Thank you so much, Dr. Smriti, for joining us. So I will, let's start with, yes.
Yeah.
So after delivery, yes, as we all know, new mothers are going through so many things, but the most worrying part is the hair fall. Once you comb and you get so much bunch of hair, we are like, oh God, this is another problem for me. Already I am doing so many things. So how to handle this, Dr. Smriti?
So absolutely right. Here I would want to tell you few very important points about it so that you know what exactly happens when a lady or a mother is going through the hair fall. With which, if you will, the way that you will understand, and then you will never ever worry about it. There is an old saying in Hindi. It's like जब बच्चा माँ को पहचानने लग जाता है, तब माँ के बाल झड़ते हैं. This is a very old saying, and it is scientifically true as well. So the eyes of the child, the gaze becomes quite steady by 3 months of age, and the vision becomes a bit farther than just here. Before that 3 months, आपको बस ऐसे करके दिख रहा है. After that 3 months, your gaze becomes a bit more steady, and that is when you start recognizing the mother well. And this is the exact time, 3 to 4 months post delivery, is when your hair starts falling. And when the hair starts falling, the mothers come to me, and they'll sometimes come to me with the polythene full of hair. And मैम देखो मेरे इतने बाल झड़ रहे हैं, मैं गंजी हो जाऊंगी. मैम ऐसा एक तुम पकड़ के रखो, तुम गंजे नहीं होगे. Majority of the times I'm saying that don't worry, I can write it on stamp paper, you will be fine. You will absolutely be fine. The point when you are getting your hair fall is a sign, it's a good sign that the hair cycle has restarted. So here in very, very quick terms, I'll tell you what exactly happens. This is called as postpartum telogen effluvium. For the science geeks who love to Google, please Google the word telogen effluvium. So in hair, what happens is we have 90% of our hair in growing phase, 10% in resting phase, and 1% in falling phase. During pregnancy, the body has to do a lot of job. You are creating a baby out there. So body says, yeah, let me not focus on the hair and the nail. So it stops growing the hair. 70% of your hair go into resting phase. When you deliver, all of those, the resting phase has to now fall. Okay. So what happens is the resting phase is of 3 months. When you deliver, then the resting phase is of 3 months. After 3 months, all of those 70% of the hair have to fall. Okay. Once they fall, then only the new root will have the space to come up. So then you will be seeing like, oh my God, I have hair in my bathroom, in my pillow, in my hair, in my comb, and everywhere. I don't want to wash my hair. Don't do that. Please wash your hair. It's absolutely fine. Because after that, once the hair roots fall, your growing rate will start. But the growth rate is of 1 centimeter per month. So you will have to wait for another 3 to 4 months, or maybe 6 months if you have long hair like me, or maybe 9 months if you have even longer hair till waist and all, to get that ponytail ka thickness back. Okay. So have patience. But here what I tell people is that this is now the soil for the fresh hair growth. So if in that soil you are giving a deprived sleep, you're not resting well, you're really focusing on getting your pre-pregnancy weight back so soon. I mean, I want that weight back in 40 days. Don't do that. That is when, and you're not nourishing yourself. You are throwing the laddus out of the dustbin because mama ne kaha tha aur laddu mein bahut calorie hota hai, I don't want to eat that. Don't do it. Because the soil, if you're not nourishing it well, your hair, which will come back in 3 to 6 months post delivery, from the 3 months when they have started falling, after then in 3 to 6 months, you can get them back without any treatment. But it can continue up till 2 years post-delivery, 5 years post-delivery. I've seen 10 years post-delivery also, only because the mothers stop taking care of themselves. And I tell them, you are the mother, you are the foundation, you have to take care of yourself first.
Very well said. Yeah.
Add to our discussion, Vidya, we were discussing about, the child looking at the mother and smiling, right?
Yeah, even we were told the same. I was like, your doctor is smiling at you, now you will start falling. So, yeah.
Yeah, so this is true. It is scientifically true, and it's like आपको पुराने जमाने वाले वो कहावतों से पहुंचाते हैं. So this is how it happens. Yes.
Yeah.
when when, when we are so much sleep deprived, okay, hair fall is there, and also we have this puffy eyes, and we have dark circles under the eyes. We look so drained. How, I mean, when we look at ourselves in the mirror, we feel, oh God, what is wrong with me? Please, I want to do something. How
Yeah.
do suggest during this time?
So step number one is stop. No, just because you have got a new baby with you, love the baby a lot, but don't stop loving yourself. Don't stop taking care of yourself. Most important thing about being a mother is that you feed the baby, because that's what you can do alone. But besides that, please take help. Always remember this line. I keep reminding myself till today. I have 2 kids, and I'm like, it takes a village to raise a kid. So please don't try to be a superwoman. Don't try to be a superhuman. You're not. And it's okay. You are just a mom. Just a mom. It's okay. So please take help. Just breastfeed the baby and give the baby to somebody else in the family. Let it be your husband. Let it be your caretaker, your mother, your father, your mother-in-law, your father-in-law, anybody. So that you also get to sleep. And that is why the nature has made the mothers, and there is something called as casomorphine, which is liberated in the mother's milk that induces sleep immediately in the mother and the baby. You are sleepy because your nature also wants you to sleep after every breastfeed initially. So when you will be sleeping, you will not have any dark circles. But in case you are doing all those things very well, always remember that the nature has designed, if you are taking care of your rest well, if you're taking care of your sleep well, and still you are having dark circles, then remember that nature has designed us in a way that when you are breastfeeding, the nature will nourish the baby at the cost of the mother. At any cost, it will always nourish the baby. So if you are not taking your iron well, if you're not taking your calcium well, if you're not taking a balanced diet, and if you're not taking your fluids well, you'll still have dark circles.
Okay.
Whatever creams we give you, they will be temporary if I do not correct these things. So it's a very simple thing which I personally had noticed. If you, after like 1.5 months, you have started giving baths to the baby, and while giving bath to the baby, you are having this. This is a sign that you are iron deprived. You should not start, panting just by carrying a 3-4 kilos child. That is a sign that your hemoglobin is coming low, and that will definitely come up as dark circles.
Okay. Oh, that is really, everything is interlinked, Dr. Smriti.
Everything.
It's like, yeah, it's really, I feel whatever you're saying, I'm able to recall whatever I went through. Really, I'm sure most of the new mothers are also feeling the same thing. And so we are talking about face. So
I just have one question, Vidya. Dr. Smriti, you're saying that whatever dark circles we have, that's mainly related to the iron deficiency.
No, there are multiple factors. One is definitely that, so I said like the sleep is right or not. It's also about the circadian rhythm of the sleep. As in, if you are not sleeping on time, 10 p.m. to 4 a.m., 10 p.m. to 6 a.m., that is what we need. If you're instead going towards 12 and beyond, right? That is when your thyroid also gets haywire. And then hypothyroidism, even if it is not coming clinically, you do not need medicine, but then your thyroid is overworking if you're pushing yourself beyond midnights. So that is when it is also that your dark circles will come up. It's also about all other vitamin nutritional deficiencies. So I had said in the beginning itself, you have to take your balanced diet. It's also about the fluids. So if you are fluid deprived, see, we need 2 to 3 liters of water per day in pregnancy, but we'll need 4 to 5 liters in exclusive breastfeeding phase, because we are giving, even the water is going through our milk. So that is very important to remember, that you will have to keep taking a lot of water, a lot of fluids, especially in the summer season.
Right. Okay. Yeah. Yeah. So I was asking, what I was asking is we are talking about face. So I was thinking, do we develop acne after delivery or during pregnancies?
So it depends, different skins, they behave different ways. Some people tell us that pregnancy was the best time for them and their skin glue like anything. So it depends what kind of face you have. Usually progesterone is high in the pregnancy and you can get more pimples if you are an oily skin. And post delivery also you can have spurts, because what happens is that the pregnancy hormones, they take up to 3 to 4 months to subside. So you can always have, flare up of the acne, especially if you have got oil glands activity. So the basic skin care, like, having a good face wash, which is an oil control face wash. It depends what kind of skin you have. If you have oily skin, then salicylic acid based face washes are good enough. And you can use them, or there are mild tea tree oil based face washes also that you can use. A good moisturizing routine using non-comedogenic, the word is non-comedogenic moisturizers and sunscreens that you will use as a protocol. It will help you to take care of the acne. And then if you require, then you can always ask a dermatologist who will help you in getting treated for the acne with the creams that is appropriate for the kind of skin that you have. But a desi nuska, if I may tell you, a multani mitti or a chandan ka pack will actually work wonders on a acne which is full and with a pus and all those things. So you can try all those things. Don't go overzealous with scrubs. That's very important thing that I would want to tell you. Scrubbing will only aggravate the acne. And keep washing with plain water and keep applying moisturizers, which is non-comedogenic. That will help you.
Okay. Doctor, do you suggest, is it okay to use commercial face washes post-delivery immediately? Because they suggest to use, basin or green gram mixed with. So I was not given commercial soaps initially. So how safe it is for to use it?
So the mild cleansers that are available, which are even safe for the infants, right? So they are cetyl alcohol based. That is not a problem at all. Some of the ones which have detergents based out of coconut, that is also not a problem. You can search for sulfate free and hypoallergenic and all those things. That's not a problem at all. I use it throughout. I give to all my patients. With regards to the safety profile, it's not a problem at all. The baby is out of your womb. It's absolutely fine. It does not go through the milk. It's not a problem. With regards to the basin ka load thing and all, it is very common to even be used by the newborns, which we can, that topic we can take up next time about the newborn skin and hair problems. So in that basin ka chane ka load, they would be doing a lot to just remove those lanugo hair. But that lanugo hair is the fetal hair that is going to go anyways. We do not suggest that, because that actually leads to pigmentation, and that risk of pigmentation is there. So in case at all you are using something like a natural thing to apply on your face as a pack, I would ask you not to scrub it. Instead, when it is still wet, just wipe it off with water and then dab yourself dry, rather than scrubbing it, causing the risk of pigmentation, which is actually as such also increased in these months.
Oh, really, this was an eye-opener kind of.
For me too.
Yeah, really.
I did not get it. Like, if we are saying, like, because this is a very common thing, I think throughout India, at least, that, people tend to use basin. Like, that is the most common thing throughout, like, North India or South India. And, I mean, they do scrub it, like, I have seen that happening. So, like, how does it exactly, increase pigmentation? That's something that I could not relate.
This is because of the friction, right? So we call it macular amyloidosis. There's a small protein that deposits, and this friction is for over many, many years. If you have seen that the basin application and everything is also very common, oiling the hair is also very common. So similarly, you would have seen the darker forehead is also very common. Uneven tone with the darker forehead is very common. Darker, this forearms is very common. Darker upper back is very common, which people keep scrubbing and making it darker. See, this happens because of the years and years of friction, either due to upturn or due to loofah that you use, or due to any scrub or wire that you are using. It's a very slow, low grade of friction over the years that happens, which sometimes come up more suddenly after few years, few decades also. So I just tell people you have as gentle a skin as of a baby. Please treat it gently. The fingers are the softest things to be touched. And then
Yeah.
just, use this rather than the loofahs and all those things. They can just cause friction-induced pigmentation after many years, if not.
Okay. Okay, that's really very informative, Dr. Smriti. Thank you. And yeah, I wanted to ask, we came across this word called melasma. So what it is? I mean, how is it really, you have to worry about it or it will just fade off?
So melasma, once it comes, it does not fade off on its own. Melasma is basically a pigmentation. In Hindi, we call it as chai. So
Yeah.
what happens is you will see the chai's shadow, right? So you will see the patch of pigmentation coming here. The
Okay.
commonest age groups when the ladies get it is either during pregnancy or immediately after the pregnancy, the during pregnancy thing, which is called as cloasma.
Okay.
And you can get it in the perimenopausal, menopausal age group when again you are getting the hormonal changes. So it is basically because of the hormonal changes that a lady goes through, which leads to these giant. And then when you have this sun exposure around you and you're not using sunscreens and all those things, that is when it aggravates. I have seen so many ladies, especially the cooks in the houses, they have big
Yeah.
patches, blotches of melasma, and they would say, we never go out in sun. We are from the morning till the night, from the morning 6 and the night 6 p.m. We are in the house. So the gas stove that is coming, the window pane sun rays that are coming, they are also factor, and the tube lights and all those things, the UV lights, they are also the factors to aggravate it. That will never go on its own. They can fade off with a good and religious usage of sunscreen and moisturizer application and physical protection of sunscreen, take an umbrella or your goggles or some masks and like that. But once they are there, we have to use some depigmenting creams like alpha hydroxy acids, beta hydroxy acids, or some anti-melanin pigment, anti-pigment creams according to the suitability of the skin. Usually it takes anywhere between 3 6 months of time and it subsides. But then the maintenance feel or phase of the sunscreen has to be continued. Otherwise, these melasmas, because of the continuous hormones that are changing in the lady's body, they have always a notorious tendency to come back.
Okay.
Okay.
I just have one question. So, is there any way to prevent this? Because you said it's hormonal changes, right? I was like, truly speaking, I was scared of it because I have seen my mom having it, and I was pretty much sure. I was scared of it. I was when I got pregnant, I was pretty much sure that I'm going to get it because I've heard people saying it's genetic as well. So, is there any way? Like, luckily, I did not get it, but then, is there any way in which we can prevent this from happening altogether? By maybe dietary changes or something.
So see, a good diet helps always, but in melasma, to prevent it, the best case scenario is to have a good sun protection during pregnancy. And the ladies who are really worried about the chemical sunscreens and all, they can always use physical sunscreens. The physical sunscreens are basically
Right.
the zinc oxide and the titanium dioxide based sunscreens. I commonly tell people, you must have seen this cricketers, applying this white sunscreen when they are in the Indian fields playing in India and all because they just don't like the heat here. So those sunscreens, although we have good formulations, they don't keep a white patch on you. But that sunscreen should be used every time you go out. It should be used 30 minutes before going out in sun. It should be repeated every 3 hours you go out in sun. It's a very good idea to wear very big dark goggles because they'll cover half of your cheeks. And nowadays, thanks to the pandemic, we are wearing masks. So the half of the other half is also covered. Inside, they should also use the sunscreen at least, when you're going near the gas stove and all those things, because it's just increasing it. A good sunscreen and a physical sun protection is going to usually prevent it. From dietary perspective, when I treat it, I give you vitamin C. Vitamin C has a lot of anti-pigment action. So why not to take vitamin C in your diet? Lots of fruits. All fruits have vitamin C. So just take lots of fruits. So that should help you.
Yeah, that's true, Dr. Smriti. But again, do you think we are restricted a lot of foods? New mothers are restricted with lot of food and fruits. So how do you link? I mean, nutritious food, whatever they give is enough, or should we add something to it for the first 40 days, especially?
the nutritious foods, what are you restricted to? The things that are more restricted to are the ones which are difficult for the baby to digest.
Right.
So, like I come from north, so we will whether it is non-vegetarian food and some dals like rajma and all those things which can be very heavy and urad dal, that would be restricted. But fruits nobody restricts. So and so vitamin C is there for you with the fruits. So I don't think that's a problem.
No,
But having said
I
that,
think in South
yeah.
India there are some restrictions on fruits as well, right? Vidya, we were discussing the other day that yeah, I mean there are. I think Vidya was allowed just bananas.
Yeah, bananas.
So,
That also
so
does.
just go by what you have been asked. You can always try to make the elders understand that it is fine. But if they don't understand, I think it's okay. Please go by what your tradition is. Whatever is allowed, just have it. If nimbu is allowed, have the nimbu pani. If the
Yeah.
vegetables are allowed, have the vegetables, because the vegetables have antioxidants. If they don't have vitamin C that much, they have vitamin A. But then tomato has it, right? So if the South Indians, you are not having anything else besides banana, you are having tamarind in the summer, right? So I'm absolutely okay about it. When you are having a complete food meal of any traditional Indian side, whether it is north, east, west, or south, I am really rest assured that you are having a good balanced diet. It is
Yeah.
only when you start restricting one part of it, because I don't like this, because some researcher has said this is bad, that is when I really worry. Otherwise, I'm absolutely fine.
Okay, yeah, that's true. And coming back to again face, there one of our new mothers had a question like, what to do when we have skin tags? Like she had it, and they wanted to know, do we have any over-the-counter medicine, just to take it at home, and any remedies, and when should we consult a dermatologist?
So skin tags basically have a tendency to increase in number when you are pregnant, and that is because of the hormones of pregnancies. Skin tags are
Yeah, so
benign,
add
they're
to it,
benign
I
growth.
think, sorry to interrupt, doctor. I think, like, she also had mentioned gestational diabetes, right? Vidya,
Diabetes.
yeah, she was
Sorry.
going she wanted to join the session, but because she's not in India and it was like, night time for her, she was not able to join. Yeah, but she had this gestational diabetes, and I think now she's suffering from the skin tags, right?
Yes.
So you have actually pointed out 2 points. So that let me tell you the first question which Vidya has asked. So here the skin tags will be increased because of the hormonal changes in pregnancy. They do increase, but they are very benign. They don't cause any harm to you. They're just increasing, and usually they will be in the sites of friction. So whether it is your neck, whether it is your underarms, they can always come in below the breasts and the heavy breast ladies and all. So that is what it is. But once they are there, they cannot be removed by any creams. They have to be removed. This is where I really cannot help you with regards to any desi nuskhas, because once they are there, when you are trying to remove it with any of the formats, there will be chance of bleeding. On the contrary, if I do a procedure like laser or radio frequency removal, it's such a small office procedure. It's a small machine that we do it. And some of them are so small that I do not just apply you an anesthetic cream and just remove it, tuck, 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 while talking to you. And you'll not even know when it is like totally gone. And you will get your new skin back in 4 5 days. So you can definitely remove this but we would never suggest all these removals during pregnancy. You should wait it out. And post delivery, it's absolutely fine to start immediately, but why? You want to focus on your baby and yourself for first 40 days, and then after that you can always get it. The second part which Niloufar has shared is the gestational diabetes. Now skin tag has actually a direct relation to gestational diabetes. So as Niloufar has said in the beginning, I always tell people skin is the mirror of internal body and mind. When you are getting skin tags, and you also see if you have got the black thick line at the back of your neck, and the dark underarms, and the dark medial aspect of thighs, which inner aspect of the thighs, which is not only dark but also thick. This is the first sign that body gives you of insulin resistance, which
Okay.
you listen to it. You just take care of your diet, take care of your exercise during pregnancy. Don't get into spurts of increase in the weight. Have a controlled weight gain. go for lamas or, prenatal yoga classes and all those things, and you will be sorted. So this is
Okay.
more of a marker, once it has come, you have to
Okay.
remove it. But once only one comes, it's a good marker of diabetes or insulin resistance coming up. So it's better to take care of diet and exercise.
So like once we have it, the only option is to get it removed. It cannot be cured
Yes.
by any disease.
No, no. Yeah.
Yes, doctor. This is one important thing I wanted to ask you. What we do is something goes wrong. We always Google is there for us to browse. So we just enter something and see. Okay, so many people are facing this. This is okay. This is okay. Let me try this. How dangerous this can be when it comes to skin, because not many skin rashes. It could be for any reason. We just don't know, and just trying to medicate something by ourselves, we'll be putting ourselves and baby into risk. So how do you suggest what to do when something
Actually,
comes up to my skin? What should I do? The next thing.
you have answered the question well.
Yeah.
So, but but I would always say that it is not a harm at all to, always ask your doctor. It's also
Yeah.
not, it's not a very big problem to, I have always have, we call ourselves yoga moms, we have a group of ladies who support each other. So it's not a problem at all to have a good support system. But ingesting or even applying some medicated creams, whether the medicine comes from allopathy, Ayurveda, homeopathy, or anybody, it's like you are becoming Neem Hakim Khatrai Jan. So you have to go to the person who knows the specialty and you go for it. When it comes to the desi nuskhas from the skin aspect, everybody is a doctor when it comes to skin. And some are the tried and tested ones which you have been trying on your own selves. Like, people apply cucumber for dark circles and all those things. You can keep trying, but then I always say eat a cucumber rather than applying a cucumber. So that will give you good amount of nourishment. So yeah, Google is there. Google helps in at least diagnosing, but it also helps in scaring you.
Yeah.
Yeah.
So, when people come to me, I actually tell them the good websites. There are certain websites. I will just discuss them according to the problem that they have there, that which are written by the doctors for the patients. So, which will give you a good, clean picture, and then you can always go to your doctor and ask. It's always better. Yeah.
Okay. Yeah. Yes. Thank you so much, Dr. Smriti. I think I am done with my questions. So if Niloufar and any of our joiners would like to ask some questions,
I
I
guess
think
we're
some
having
of
some questions actually.
yeah, yeah.
Would a spray, like, I mean, I think we can just take up this question. Would a spray sunscreen with its ingredients on its long run be toxic? Could be bad Googling, but heard this somewhere.
It's a good question. So basically, what happens is so there are various types of sunscreens that we have. Whether it is a spray sunscreen, so spray sunscreens usually people from type 1 to Fitzpatrick skin. So we are like wheatish skin, right? Indians, we
Yeah.
burn, we tan, we don't burn. But sunscreen is all the more important for the races which have type 1 and 2 skin, which is like really fair, especially the one from the Western countries. So there they have a tendency to burn a lot, and there the risk of skin cancers and all is a lot. So whenever they are going out in sun, especially the beaches and all, they will be required to apply the sunscreen all over the back as well. Whatever the exposed area is, we would hardly tan, but they will burn. So that's why the sprays have come up, because it's easy to apply all over the body. They even have sunscreens for the hair and the scalp as well. So here you will have to just, go through few ingredients like PABA, paraben. Those are the buzzwords that you should refrain from. And nowadays people have become really aware that these things have to be refrained from. Some studies have shown that they are carcinogenic and all, and majority companies now are not coming up with that. So it does not matter which kind of sunscreen formulation you are using, whether it is a spray or a cream or a gel or a lotion. It's more about what is the constituent in it. And I would always tell people to, if you're really, really confused, either go to your dermatologist or just opt for a physical sunscreen, because physical sunscreens are safe for even children, and they have usually they are broad spectrum. They will be covering UVA, UVB, because they're just a coat, they don't get absorbed into the skin, and the ingredient is usually zinc oxide and titanium dioxide. So
I just
those
have
are
one,
also the formulations in our foundations and calamines and all those things.
yeah, I just have one question. Like zinc oxide, is the particle size big enough that it does not get absorbed into your skin pores? Both zinc oxide and titanium dioxide. Is it something related? That's why we
Yeah.
call them things, right?
Physical sun, yes, 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 yes. And they just have the property of coating. So it's a physical sun
Okay.
protection salts.
Okay.
Yeah, there's one more question, Nilüfer. Somebody's asked.
Let me check. Are you able to see that?
I'm
No,
also sorry.
yeah, I'm just thinking.
I'm in third trimester now. I have developed overall hyperpigmentation, particularly neck, armpits. What can be done now and post delivery? So, Yugandhara, you do not worry at all about this pigmentation. In my second pregnancy, whole of my neck was black, and now it is now my skin color. So this kind of pigmentation is because of melatonin hormone, the hormone of pigmentation, and which is under the other hormones of pregnancy, and they always come up during the last trimester, last month of the pregnancy, and they will get down slowly, slowly. As I said, that the pregnancy hormones take up to 3 to 4 months to totally subside. So they will eventually go and fade off. The only thing that you can do is continue your sunscreen, continue your good diet, and just forget about it. Don't think about it. It will go. For sure. You see
Yeah.
myself, it's gone. It will go.
Seriously, you're so cool, Dr. Smriti. It's like you told the basic, very basic steps which we can follow easily. Like, have a lot of fluids, just take care of yourself. Don't be just with the baby. Once you complete your breastfeeding, let others take care and ask for help. Have nice, good, your traditional food is enough for you. That is the most important thing. We think, okay, I should not eat this, I should not eat that. Nothing like that. Just eat whatever is given. But yes, don't overeat. And basically take care of yourself and don't apply, don't keep a cucumber on your eyes, but better to eat it because it has lot of properties
Yeah.
yeah, it's really these basic things are very important, which we tend to forget. We don't remember the simple things actually.
Right.
So
And
in the overeating aspect, also remember that traditionally Indians, they have been taught to have mitahar. So you should be eating only till you are three-fourths full, and 75% of your stomach should be filled with food, and less of the 25% you should keep for the fluids and the gases to move in. So your baby is like this size, one-fourth of yours. You're not eating for two. Please stop eating for two. And
And I don't know why people
ate I personally never ate more than what I used to eat in pregnancy and all. It was just that what happens is that after every feed, you are hungry. So your number of feeds increase. So throughout the day, you're overall increasing more, eating more. But this does not mean that in every meal you are eating a lot. Don't do that. If you just refrain from that and just listen to, and you will only listen to your signals. But if you do not watch television or mobile, and complete that Instagram thing and the Netflix thing while you are eating, just don't do that, and you'll be fine.
Yeah, I
well
don't
said, well
know.
said.
Most of the pregnant women have this, like, everyone saying to them at their home that, you should eat everything and how much you want to eat during pregnancy. So that should not be the case. You are yourself. So you can eat either before pregnancy or after pregnancy. It's not like, pregnancy is that clean chit you get that you can eat anything and in any, how much ever quantity you want. So yeah, I mean, we should have a watch on what we are eating even when we are pregnant, because it's not a clean chit to overeating or unhealthy eating at all. That's something that we need to remember, and that is very well pointed by Dr. Smriti as well. Saying that you have to keep things under control and in check. Like we should not be like let loose in the area of consuming food.
Yes, and also listen to your skin. Observe your skin.
Yeah,
Yeah, I talk.
absolutely.
Yeah, I'm
It always gives the signals. If you're feeling very dry skinned, your thyroid may be functioning low. If you have got dark circles, you need to sleep more. You need, if you are having this, you need to increase your iron in your diet. You can just put some moringa leaves in every dal that you are taking, and then you will
I saw
increase
that
your
too.
iron uptake. And keep having lots and lots of fruits, as natural fruits as you can, of course, if your family members allow you. And just enjoy, eat first, eat once you have like post 6 months and all, eat your food first and then run after the baby. I mean,
yeah, true.
they take forever to finish the foods, so you
Yeah,
just
and
please finish your food first.
yeah, and since Dr. Smriti mentioned moringa leaves, there's a wonderful post on her feed. I
Mhm.
happened to check it when I was scrolling through, so that is really informative. Like you've mentioned, the different. It's actually a traditional Indian food, and we I
Yeah,
don't think we give much importance to it. Yeah, I mean like we have it in sambar and all, but then the leaves, that was something new to me. Like once I read it, what you have written. So yeah, I mean, you can go and check that as well. I mean, it's really informative. Yeah, so I recommend checking out that post.
Yeah. And yes, new mothers out there or anybody who have any questions, you can post in the comments. We are almost at the end of our session,
You exceeded
and
actually.
yeah, okay. The topic is so good, and we just continue talking. So please feel free to ask questions. We are going to tag Dr. Smriti's handle as well in this video. If you want, you can ping her or DM her on her Instagram and or post your comments or the queries. We can pass it to her.
Thank you.
absolutely, would love to answer all the questions that you have.
Yeah.
Yeah.
Thank you so
Thank
much.
you so much, Dr. Smriti.
Thanks. Thank you. It was a lovely session interacting with both of you. Thank you. Thank you so much.
Thank you.
Thank you so much. Yes, we want to have many more sessions. Yes, thank you.
Thank
Hopefully
you.
soon.
Yeah.
Bye.
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 So I'll be just ending the session. Thank you.